Your phone rings. It is from your doctor's office and you wonder if this call is about the results of your recent cervical screening test. And you expect everything to be normal like it used to be, and why would it be otherwise? Instead, the nurse is telling you that you're likely to have a cancer and you're being referred to the cancer specialist doctor or else the oncologist to discuss this in person. I am Dr. Joanna Nixon. I am a consultant oncologist with over 15 years of experience in cancer management, and I'm also a coach. So here I share with you science-based and practical ways on how to foster your well-being, even when you're faced with you or a beloved one with a serious illness, including cancer. In this video, we will talk about the first appointment with the cancer doctor when you have just been told you're diagnosed with cancer. In the end of this video, you will have a list of must questions you should be asking your oncologist. You should ask the medical team in that first appointment, as well as some tips. So you hanged up the phone having just been told you're referred to a cancer specialist doctor because you have a cancer. What now? Knowledge is power, knowledge is key, and together we will look at tips to how best prepare you for this very important first visit. So tip number 1, take someone you trust with you. Don't go alone. Take someone you trust with you. This is crucially important, and here is why. Research and lived experience of people with cancer suggests that as soon as someone hears that they have a cancer, they stop listening to anything that is said beyond this point. They just stop listening. What plays in the head is, I have cancer, I have cancer. So it is important that in this first appointment, you have someone with you that hears everything that is said in this consultation. So they will serve you as your eyes and ears during that very, very first, stressful first visit. Tip number 2, take notes. Get a notebook with you and ask the person who is with you to make notes. Although you will be given written information about what is said in this consultation, it is important that the person with you just takes notes during the visit. This will serve you as a summary of your understanding of what is said, and you can always go back to it. But it will also help you to ask the questions that and clarify the points that are unclear to you and are most important to you. So make notes. Tip number 3, there's no daft questions, so stop and ask. Always remember that the oncologist, we are there to help you and support you all the way through. Your oncologist, your nurse is there to help you. And the more they know about what is concerning to you, the better place they are to support you and your unique needs. So they're there to answer all your questions to the best of their ability. So stop and ask. Please do. Tip number 4. If the question, am I dying, is constantly playing in your head and you dread asking, ask the question, simply ask the question. Frequently people, as soon as they hear they have cancer, they automatically think they're given the death sentence. So remember, cancer is very diverse. It's not one disease. It's extremely diverse. So therefore, this perception is not true. So ask the question. Tip number 5, ask what cancer you have and what the name for that cancer is. This is important information to know. There are systems we use to define the extent of the cancer and how big the cancer is in the organ it arises from, as well as whether it's spread to any of other parts of the body and which parts. So we need to know all that, and we also need to know the name of the cancer. So ask. Don't leave the room without having that information in hand. Tip number 6, ask what other tests are required and why. Tip number 7, ask about timescales. How does your unique cancer journey look like? How will it look like for you? What types of treatment do you need or are you likely to require, and what is the likely sequence? How long will it take before all phases of the treatment are completed? Tip number 8, ask about the imminent next step. So what do you expect done? By whom and when? The most important thing to remember is be calm. I know it sounds easier than done, but be calm and keep a positive mindset. Be calm and keep a positive mindset. This is important, even under the most challenging circumstances. I know you can. I do. If you like this video, please like and share with others that may find it useful. If you found it useful yourself, I would love to hear from you about one thing that you found useful and why. Till we meet in the next video, please remember, you can always be empowered and in control, even with ill health, even with a disease, including cancer.